Vaccine Answers, sponsored by the Froedtert and the Medical College of Wisconsin Health Network.
The wheels are in motion to sunset this pandemic.
Hope in a vaccine vial.
I've been homebound, and I'm hoping that I can get to see my new great-grandchildren.
3 COVID-19 vaccines, our shot at returning to our way of life.
What are you most looking forward to once you're vaccinated?
Tonight, the questions you have. Where can I get a shot? When will I be eligible? And what can I do after my shots?
The vaccines are what is going to get us out of this pandemic.
This is a WISN 12 News Special, Vaccine Answers.
Good evening, I'm Patrick Palantonio.
And I'm Toya Washington. In the next 30 minutes, we're going to guide you through everything you need to know about the COVID-19 vaccines.
As you watch, we also invite you to join us on Facebook Live. Our Derek Rose is taking your vaccine questions to our panel of experts from Froedtert. Dr. Joyce Sanchez is an assistant professor of medicine and an infectious disease specialist, and Dr. Jerry Wynina is an associate professor of medicine and surgery and medical director at Froedtert's preoperative clinic. Log on to the WISN 12 Facebook page while you watch tonight. The discussion will continue until 7:30 to get through as many questions as we can.
And during our special this evening, we'll also be talking to a pediatrician about children and the vaccine. Clinical trials are still underway for children. We're going to ask about the timeline for when they might be vaccinated. Our 12 News' Nick Bohr examines a year of COVID and the incredible speed researchers develop the vaccine. We'll also talk lingering vaccine hesitancy with Diana Gutierrez, particularly in minority communities. And I ask an OBGYN about what pregnant women should ask before getting the shot. And later, for those who are vaccinated, now what? Kent Wainscott on what to expect.
And throughout the show tonight, you'll see a QR code appear on your TV. It looks like this. We're going to show it to you in the right-hand corner. You see it right there. Here's how to use it. Open the camera on your smartphone and point the camera at the code on your screen. You'll see a tab drop down from the top or appear on the screen. Tap that and you'll be taken directly to our special vaccine section on WISN.com.
So many of you want to know when you'll be eligible to get the vaccine, and just hours ago we learned who will be in that next vaccine grouping starting on March 29th.
The state says it includes more than 2 million additional people in Wisconsin, anyone 16 and older with pre-existing health conditions.
It is based on the best evidence we have about which medical conditions make someone more vulnerable to severe illness or death.
The list of the conditions is scrolling on the side of your screen right now. People with asthma, cancer, heart conditions, the immunocompromised, obese, pregnant, and those with diabetes are among those on the list. Again, eligibility begins on March 29th. The state says eligibility will open to everyone sometime in May. President Biden wants it to happen by May 1st.
And people in these groups are already vaccine eligible and can get the shots now. You see them on the screen. Adults 65 years and older, teachers, child care providers, public transit workers, farm workers, grocery store workers, and people working in cleaning, HVAC, as well as plumbing industries. And since the first vaccines were approved in December, there has been progress in getting Wisconsinites their shots. Vaccinators have administered more than 1.8 million doses so far. Some 660,000 people have either received both doses of the Pfizer or Moderna shot or the J&J vaccine, which requires, of course, only one shot.
Vaccine development has happened at record speed. 12 News' Nick Bohr shows how the 3 vaccines available now stack up and the lessons learned for facing future pandemics.
Even as COVID began to take a toll in the U.S. a year ago, scientists were already figuring out how to stop the virus in its tracks.
The road to vaccines have been paved with a lot of failure. And fortunately with this one we had now 3 really good successes.
Dr. Jonathan Temte at UW-Madison is one of the nation's leading experts on vaccines and is co-chair of the state's COVID-19 Vaccine Advisory Committee.
Moderna and Pfizer vaccines are very, very similar. I think they differ only a little bit in the chemical that carries the messenger RNA.
He says Johnson & Johnson takes a different approach, using a common cold virus to trigger the immune response.
Different in just the way it gets the material into our cells.
Dr. Temte says the foundation was built even before there was a COVID-19.
There had been some trial vaccines prior to SARS-CoV-2, for example, with the Middle East respiratory syndrome virus. which is closely related. So the technology existed, and fortunately, the genetic blueprints of this virus got shared very, very early across the world in January, and this is available to the companies to start working on.
The only vaccine trial in Wisconsin is based here at UW Hospital in Madison. They got on board early, realizing that COVID treatments were only going to be part of the solution. Did you think a year later we'd be talking about 3 vaccines approved and then maybe a 4th on the way?
I don't think that any of us really thought that that was possible.
Dr. William Hartman directs the AstraZeneca vaccine trial here, a 4th vaccine he expects will be approved as early as next month.
No corners were cut. It hasn't really been a race. It's more just how many of these can we say are safe and effective, and it's been exciting to be part of that.
Dr. Hartman is also a full-time anesthesiologist here, seeing the daily toll of COVID-19 up close.
I wish I had the luxury of not seeing what I have seen so that I could think maybe this isn't such a big deal. But I've seen how it affects the people in the hospital, how they're isolated, they can't interact with their families, and their dying breaths are taken alone.
And he believes these vaccines will put an end to that tragedy, repeated in Wisconsin now more than 7,000 times.
The vaccines are what is going to get us out of this pandemic, get us out of this mess.
There we go.
In Madison, Nick Bohr, WISN 12 News.
The advice from doctors now: get vaccinated as quickly as you can and take whichever vaccine is offered to you. Now, in Wisconsin, you don't have a choice of which vaccine you'll get.
But experts say they are all effective. And here are the numbers. Both Pfizer and Moderna's vaccine have efficacy rates of more than 94% at preventing symptomatic COVID-19. Johnson & Johnson's vaccine shows about 66% efficacy, but this testing takes the virus variants into account. Pfizer and Moderna's early trials, however, did not. Johnson & Johnson data shows its vaccine is still 86% effective in preventing severe illness. And this is a key statistic here. Experts say all 3 vaccines are 100% effective at preventing hospitalizations and deaths in vaccine trials. Now, people who are eligible to get their shots in Milwaukee can do so at the Wisconsin Center. We've been telling you about this for weeks. The site is open 7 days a week, and you can make an appointment on the County Health Department website. There are also several other options to sign up. Wisconsin's vaccine registry is slowly adding more county health departments, directing you to exactly where to sign up. Wauwatosa's is currently using the registry. Some stores are doing vaccinations as well. Those include Walgreens, Walmart, Meijer, Pick and Save, Metro Market. And links to all of these signups are online right now at wisn.com/vaccine. But if you don't have access to internet, you can also call the state. Write this number down. Wisconsin's vaccine phone line is on the screen right now, 844-684-1064. Now, a lot of you have asked questions about vaccines and children.
Right now, there is no vaccine approved for kids under the age of 16. So when will that change? I talked with a pediatrician who's also the chief medical officer at Children's Wisconsin.
As pediatricians, we are focused on prevention, and vaccine is one of the most effective ways to prevent the spread of illness.
What is the status of vaccinations for children?
It's interesting because currently only one vaccine is licensed for 16 years of age and older, and that's the Pfizer vaccine. Of the 3 vaccines that are currently available in the United States, that's the only one that has an indication for anyone under the age of 18.
When you look at the Pfizer, that's approved for anyone 16 and older, Moderna and Johnson & Johnson for 18 and older. When their time comes, how important is it for younger patients, those in their late teens, to get the vaccine?
I think it's important for everybody to get the vaccine. As we know, we've heard so much about herd immunity and the importance of herd immunity in protecting all of us as a society from COVID's devastating effects. So it's really important for anybody who's eligible to receive the vaccine. As we know, the Wisconsin Department of Health Services has a phased approach to introducing vaccine and creating eligible categories. And so once that eligibility comes up, for those who are 16 and up, I would encourage all to get it because all 3 vaccines are safe and effective.
How about for younger children? What's the timeline for vaccination?
Very good question. And the answer to that is we don't know yet. Our best guess is that the studies are being done right now in some populations as young as 9 years of age. We're hoping that there will be approval sometime later this year for at least part of that population who are under 16. Our guess is that for the very young children who are under the age of 9 or so, that may not be until the year 2022 or thereabouts.
So we could be a year off, potentially, or close to it?
For some of the younger kids, yes, I want to emphasize that. For the individuals who are 9 to 16 years of age, it might be sooner. In fact, we're anticipating it will be later this year. That's what we're hoping for.
If a child has a pre-existing health condition, will that bump them higher up on the list?
The age will be the determining factor at first, and then if they fall into the category of chronic health conditions, then that would bump them up the list from those who would otherwise be healthy, if that's the strategy that has continued to be used by Wisconsin Department of Health Services.
Why were children not part of the initial test group when they were testing these vaccines?
That's fairly typical. For a new vaccine that's being tested, usually the initial tests will be done with adults who are 18 years of age and older in this case. So one group 16 years of age and older. And there's multiple reasons for that. One is finding the right dose for the vaccine. First, you have to perfect it in adults and then determine what the effective dosage would be for kids if there's a change or a difference that's necessary. And then the other thing is just making sure that it's safe and effective in adults before we start testing kids.
And right now, Frater doctors are taking and answering questions on the 12 News Facebook Live. We're going to go ahead and take a second to listen in.
This to us before today. She says, I was wondering if we can reach herd immunity without children getting the vaccine. Everyone keeps talking about herd immunity, but it might be difficult if a large portion of the population, including children, cannot get it.
That's a really valid point. My understanding is children account for about 25% of our population. So with these viruses, the level of herd immunity where enough people are vaccinated where you stop active transmission because you're protecting a barrier to person by your own immunity from that virus leaking from one person to another really depends on how contagious the virus is and what level of precautions are taken. So
beautiful timing right there as we were discussing children and the vaccine. Of course, we're going to check back in on that discussion later in the show. And remember, you can submit your questions right on the 12 News Facebook page. Now, we also hear a lot of people talk about their hesitancy to get that vaccine.
Mixed feelings, especially among minority populations.
We have been in a flaming red hot zone from the very beginning.
Next, the ongoing outreach to vaccinate people living in communities where COVID has hit hardest.
Do you worry that people are going to let their guard down too soon?
Then later, what to expect after you're vaccinated and how long one doctor says we should prepare to still wear a mask.